Hello, my name is Gitanjali Massey. I'm a dialysis nurse. I work in Jefferson Health Systems since 10 years. So today I'm going to be doing my health and neck examination. And my patient will be Sheena Charles. I'm going to ask her consent if she is agreeing for me to do my head and neck and throat examination. Sheena, do you agree for me to do the head, neck, and throat examinations with you?
Yes.
Okay, thank you. All right, so I'm going to start with first I'm going to visually see her head, and then I'm going to palpate it. First, I'm going to visually, her head looks okay to me. Now I'm going to palpate for any deviation, any depression, any bumps, any lesions. Uh, if I, when I'm palpating in, is it hurting you or anything?
No.
Okay, all right, so that looks fine. So I'm going to ask, do you have any headaches?
Yes.
Okay, on a scale of 1 to 10, 10 being the worst, how would you rate the pain?
6.
6. Do you take any pain medication?
Sometimes.
Sometimes like Tylenol or Motrin?
Yes.
Okay. Does that pain medication relieve the pain?
Yes, sometimes.
Sometimes and sometimes not. Okay. Do you have any dizziness or anything?
No.
Any nausea, vomiting when you have headache?
No.
Okay. Do you remember when you were young you have a head injury or a neck injury?
No.
Okay. So basically it just comes on, it's like comes and goes.
Yes.
Okay, but I would suggest you, if the Tylenol doesn't relieve your pain, you should definitely go and check the MD so they can further evaluate your headache. All right, so now I'm gonna do her facial examination. I'm gonna check for the contour, the symmetry, any discharges, any lesions, everything, the face contour and the symmetry, visually inspecting. Everything looks fine. And I'm gonna check her temporals. Okay, they are fine. And I'm gonna check her TMJ. So I palpated her temporal and her TMJ, it looks fine. So next I'm gonna move to her eyes. First I'm gonna visually check her eyes, her eyebrows, her eyelashes. There is no crusting, no watery eyes or nothing. Can you see me and can you look the objects for, okay, no vision problems to you?
No.
Okay, so I'm going to check your eye with the pen light, and I'm going to see if they're reactive to the eye. So for that, I'm going to use my flashlight, and I'm going to, you can see in the, okay, they are, and I'm going to check I'm going to move my flashlight towards your pupils. They are they are round and reactive to the light as they're supposed to be. Okay, and then I'm going to check her sclera. They look white. And then I'm going to check her conjunctiva. That's moist and pink. That's how it's supposed to be. And then I'm going to do a 6 cardinal signs for the eye. If I'm going to move my fingers, I'm going to move it. So I'm just going to follow my fingers. So I'm going to check your pupils, like to the center. 1, 2, 3, 4, 5, 6. I did the 6 cardinal signs, and I'm going to check her peripheral vision too. And when I move my fingers, then you just tell me when you can see them. Okay. See her. Okay. So her eyes look fine, basically. And then I'm gonna visually inspect the nose. Her nasal septum looks fine when I palpate it. There is no deviation or anything, and it is symmetrical. Then I'm gonna check her nasal canal for any polyps or any. I'm just gonna slightly check your nasal canal. Okay, for the mucosa, the any polyps or anything, any drainage or anything? No. Okay. Then I'm gonna visually check her lips, her for anything they are symmetrical. Her mouth looks fine, and I'm gonna just ask her to open her tongue. I'm gonna check her dentition. Can you like put your yeah? I'm gonna just check with my flashlight. It looks fine. Her dentition looks fine. Her tongue looks fine. And then I'm gonna check her ear. Alright, first I'm gonna visually inspect both the ears, and I will whisper. I'm gonna do your hearing test with the when I occlude the ear. I'm gonna whisper a word, then you can tell me what did I whisper.
So,
Please.
baseball.
Okay. I'm gonna do. Okay. So this is like for her ear. I was just checking her occluding the ear, and then I'm gonna take my flashlight and I'm gonna check her ear. I'm gonna check her ear canal.